Hi there, and welcome to Wellness Wednesday. We have a lot of parents asking questions about chiropractic care for kids and curious about how we do adjustments for infants, toddlers, as well as teenagers. So today we're going to give you some clips of an adjustment for what a toddler would look like, as well as a teenager. And I am fresh out of infants at my house because my 4-year-old is almost 5. So our office is family friendly. We actually have a little kids corner with crayons. We also have a few toys around the office, and we have plenty of stickers that we give to kiddos after they're done coming in with their parents. We also have a bulletin board in our waiting room for chiropractic kids. We've got some pictures of some kiddos that have been into our office, and I think one of my favorites, I've got Cameron here when she was maybe about just a couple years old, maybe 2 or 3. I've got a picture of Miss Tori when she had her Einstein hair and was doing some posing in the office as well. All right, so we have Miss Tori here, and we have Spot, our chiropractic animal, who has a spine inside. So a lot of times when kiddos come to the office, they can actually help adjust the stuffed animal. So we have Dot, our chiropractic dog, which you can hear a little clicking sound. So the kids can actually practice as mom and dad are getting adjusted on how to adjust Spot. Hi there, Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health, and we are here this Wellness Wednesday to talk to you a little bit more about chiropractic care for kids. So I have some assistants today. I have Miss Tori here. She will be 5 in November.
That's my birthday?
Yes, that is your birthday in November.
So I turn 5.
Yes, you'll turn 5. Exactly. So a lot of times we have parents coming in that want to know more about how do you do chiropractic care for kids? What does that look like? What does that entail? And what does that feel like for my kiddos so that they know what to expect? So Miss Tori here has been adjusted since she was born. Actually, the day after she was born, she got her first adjustment. So we have a special chiropractic table. This is Sandy, the chiropractic pony. So this is actually a kid's table. There are little pads right here that we can use for kiddos to lay down for us to check their spine. And then we also have a couple devices. Either I use my hands, I may use some massage, or we also have this tool called an activator, which we call it the baby pogo stick or the popcorn machine. It makes a little pop sound, kind of like a stapler would sound, but it's got this nice rubber tip here, so you're getting less than 3 pounds of pressure with this, and I can also dull that down so you only get a half pound of pressure when we do an adjustment. So I'm going to have Tori show you what an adjustment looks like for a toddler. So typically, we start by standing up, so stand right here, and what we do is we check her dancing hips. So you're going to face that way. Can you face that way? Perfect. And what we do is typically I start at their hips, and I kind of feel to see how their hips are moving, making sure that they're able to move smoothly. Then what we do is we lay down on the table, so let me get some paper for you, and then I will help you get up there, or you can climb, because I know you're super independent, right? Here we go. So we're going to climb up there, and then she's going to lay face down, and what I do is typically I check to see at the bottom of her hips how her feet are moving, how her hips are moving when we lift our legs. I typically will motion out the lower back again when she's lying down, and then I will check up her spine. If we do need to do an adjustment, either I use some firm pressure, like what you would use basically to feel a ripe tomato, just enough pressure to press and move that bone back in place. Sometimes if I have an area that's tender or swollen, I'll use an activator. So Tori's actually got one little bone out here right now at L3. So we're gonna do a little pressure here, and then we're gonna use the popcorn machine, popcorn, to move that bone back in place. And that's what an adjustment would look like for a kiddo. So typically I check everything all the way up into their head. Sometimes they get a little tickly and wiggly, especially when they're little like this. There's a lot of tickle spots, isn't there? And then we're gonna lay face up. Can you roll over for me?
Yeah.
Okay, roll over. Perfect. And then she's gonna lay face up, and we're gonna make silly faces. Here, make sure your feet are on there. There we go. We're gonna make silly faces at each other as we check her neck. And if we do need to do any adjustments here, I can do pressure with my fingers, or I can use the activator again to do that. And that's what an adjustment would look like for a toddler. So thank you, Miss Tori, for your help today. There we go. Good, good. Hi there, I'm Dr. Andrea Shanowski from Freedom Chiropractic and Holistic Health, and this is
Cameron.
my daughter, my oldest of my daughters, who is going to be 12 in August. She's almost as tall as me now and growing so much this past year. So today I want to talk to you. I've had a lot of parents that come in and always ask about how we do chiropractic care for kids. So today we've got Cameron here to kind of demonstrate what a adjustment would look like for an older child or a teenager or even a young adult. So typically for kids that are large enough that they can't fit on Sandy the Pony, we have our regular chiropractic tables. We have this one in room number 2, which they're able to just lie down on. In the other room, in room number 1, we have a table that actually comes up. They can lean against it and then it goes back down when I release the pressure. So Cameron, I'm gonna have you go ahead and lay face down for me on the table and we'll demonstrate what an adjustment would look like. So an adjustment for a teenager, a young child, or a young adult typically is the same that we would do for a baby or a toddler using our chiropractic pony. Basically, they're going to be laying face down. I typically will check their feet. I'm going to check to see how their hips are moving. If there's anything out of position, I can actually set the tension on this table. So I never use more than 3 pounds of pressure. I do very quick adjusting. I don't have to do any popping or snapping. Typically, the only thing we're going to hear is the table moving. So this table actually has a mini compressor. So that'll actually pop up the table and then I set the tension so there's less than 3 pounds of pressure as it drops. So what I'm going to do is I'm going to go ahead and pop the table up here. So this will come up. As I loosen it, you'll hear that compressor sometimes kick on. This will drop down and the table drops down. So I set the tension on there. So as I do an adjustment, so Cameron's got a little bit going on here in this hip. As I pop that up, what I'll do is I just want to make sure that I've got the lightest pressure possible. So no more than 3 pounds of pressure. I'm going to put a little pressure here on her hip, and then the table's going to drop. And that's what an adjustment looks like for an adolescent, a teenager, or a young adult. It's pretty much the same thing for a regular adult as well. And typically from there, I just kind of check their spine all the way up. Sometimes we find some ticklish spots or some other areas where there's pressure in the joints. But for the most part, we're just making sure that all the bones are moving properly and putting them back in place if they're not. So thank you so much, Cameron. You can go ahead and stand up and get off the table. And that's what an adjustment looks like. Thanks for tuning in to Freedom Chiropractic and Holistic Health. Don't forget to hit that subscribe button and ring that little bell so we'll let you know about some new videos coming out. Every Wellness Wednesday, we go live at 5.